Hi everyone. So last week we talked about aesthetic implants, especially in the critical aesthetic zone. What do you do when you come back and you have cases with exposure or gray shine through of your implant? Last week we talked about cases in which we have not placed the implant. What about cases in which you have implants previously placed and you're tackling with anesthetic issues and complications? So you have shine through of your implant. How do you tackle these cases, especially in the aesthetic zone? What if the implant crown is already there? So in those cases, a similar approach would be to remove the crown that you're dealing with and tunnel a connective tissue graft in order to address the issue. A very nicely documented case is from a dear friend who's based out in Poland, a periodontist, Dr. Tomasz. I asked him to show his case here because it's done very cleanly. And the idea with this is, let's say you're doing an immediate implant or you have a previously placed crown. Once you've removed that affected tooth, you're doing an immediate implant or a previously treated implant, you would remove the crown and you are using what we call a marionette suture. So what you're doing is reintroducing a connective tissue graft on one side and holding it at that coronal position, and using that tunnel approach, you're able to introduce that graft in that coronal part where we need it the most and securing that graft in place. And then you can go back and replace your crown in the position in which it used to be. Now, this can be done for cases in which you have immediate implants you're temporizing, such as shown here. You can do this around previously restored implants in which the facial plate over time has allowed exposure or allowing that tissue to thin out. And this is a great technique which can be used to salvage prior implants as long as these cases are not symptomatic, meaning implants that don't have any active disease. Hopefully this has been helpful, and see you on the next Implant Minute.